no, sorry. Moderna is 60 to 80% effective after first dose. The Pfizer 50 to 60, but the length of that effect, no one knows. So for example, it's a good question for me because I'm supposed to get second shot on Tuesday, but the downtown is shut down. So I haven't quite figured out what's going to happen. GW formally, Janet said they're not going to cancel vaccinations on Tuesday and Wednesday, but they're recognizing that some people may not be able to drive in due to the roadblocks. It feels like it feels like I'm back in Soviet Union in Moscow during the Yeltsin's putsch, where like there were barricades and tanks downtown Moscow, and I was whatever, I was 16, I think, and I went down there to support our new democracy, climbing on barricades, waving flags, and throwing rocks at the cops. That was me at the age of 16, but I think I'm done with my political aspirations.
Wow.
But yeah, so that's a good question. Nobody knows. The chances are, though, the timing of 21 and 28 days accordingly is kind of arbitrary. What I mean by that, if you miss a week and you get it instead of 28 days, let's say 35, I'm assuming it's okay. I don't think anyone actually knows why they pick those dates. That's just how they pick it for the trial. It doesn't mean that a little later won't work. In fact, we had somebody from ID department make the claim that it's possible that later even better. But again, nobody actually has any clue as to, there's no time, there's no data.
There was an article in the New England Journal about when you get the second shot of Moderna, it's 2 weeks before it's like 95% effective. When you get the second shot of Pfizer, after 7 days, it's 90% effective, and after 14 days, it's 95.
You mean after the second shot?
The second shot, yeah. I had a bad reaction after the second shot. It was not fun.
Well, so
it didn't last very long.
So anticipating this whole issue of Norway, I'm just going to go ahead and talk about it while we wait, okay? So I don't know if you guys seen the Washington Post article today and then yesterday at New York Post and some other outlets. So Norway had 23 deaths attributed to Pfizer vaccine. The issue that, well, so I'll explain in a second why. All of these deaths were in the nursing homes, and they were not immediately after the vaccines, like same day or two. They were all within 2 weeks after vaccination, but at least 13 of those deaths are strongly attributed to the vaccine based on symptoms that evolved after vaccination. So Norway, as a result, changed their protocol, basically saying they're going to hold off of vaccinating very frail patients in the nursing homes based on this data. There are two reasons why this all came up so quickly. First of all, Norway is the #1 country in the world in terms of keeping track of everything. Every single healthcare outcome reported for the entire country. Now, the entire country is only a few million people, so it's not like it's difficult. But they have a universal healthcare. It's one payment, one payer for the whole country. So they track every single healthcare parameter within days after. So it's rapid accumulation of continuous data. So they have a capacity to report all of this very quickly in real life, versus we, of course, do not have that. And that's why it's got picked up. And then number one. Number two, they were way earlier than anybody else doing all these vaccinations. So they started vaccinations in early December. By mid-December, they vaccinated half of all the nursing home residents. By the end of December, all of them. And that's like 30,000 nursing home residents that got vaccinated. So, it's still concerning to some degree, but I think bottom line for all of us, very frail people over a certain age probably should talk to their doctor. That's how I'm reading all of this now. And I don't really see Moderna vaccine way safer than Pfizer. So I would say it doesn't really matter which one. And since we don't have any other vaccines at the moment, so that's a change. That's a major change. So, and the people were dying not from anything weird. They were dying from, they would start getting fevers, they would start getting nausea, vomiting. So like an expected side effects from the vaccine itself, which are simply the signs of the immune response. But if somebody is super frail, it may not take a lot to throw them off. So that's probably what we are. So with that, I think we should just jump right in, right? Because Nancy got a little prepared piece, and Janet, do you want to take it off?
Okay. On behalf of Access to AIM Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to A Mindfulness Experience, everyone. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health provides professional development, education, and community outreach to improve health and wellness. Today, our facilitators are Dr. Nancy Aboulmouna, who practices at the GW Center for Integrative Medicine and is a AIM Health Institute board member, and Sage Raindancer of Raindancer Healing Arts, who is a certified nature and forest therapy guide. Nancy, take it away.
All right, thank you so much, Janet. Thank you, Misha. I'd like to say yes, we would love your support. AIM Health Institute co-sponsors this with the GW Office of Integrative Health. You can get your jar of honey with your support, and we'd greatly appreciate it. So today I am going to be focusing on just some of the information on distribution in Virginia, DC, and Maryland. I'll be posting some links in the chat box just so that you have those for updated information and also registration availability to register for your vaccine. And then after talking a little bit about that, I'm just going to discuss some of the key points from President-elect Biden's American Rescue Plan. It's a $1.9 trillion plan that was just released in the last day or so, and it focuses both on rescue and recovery during this pandemic. So I'll just hit on some key points, and I'll also provide the PDF document of that for you to explore further in the chat box. Okay, so I'm going to begin with Virginia. So Virginia is now vaccinating people in phase 1 and B. It will soon start with phase 1C. And on Thursday, the Virginia's governor announced changes to the state's COVID-19 vaccination program. And they are now going to start vaccinating people that are 65 years and older. Virginia is now vaccinating. So the governor also said that people with underlying health conditions can now be vaccinated. So again, 65 years and older and people with underlying health conditions. So basically that takes into consideration phase 1C, which is being vaccinated. Those vaccinations in Virginia should begin starting next week. So I am going to go ahead and put in the chat box the Virginia Department of Health link where you can access information on registration and just stay current with Virginia's plan and distribution. And as far as DC is currently vaccinating in phase 1A and B. They plan to begin phase 1C and for those people that are 65 years and older. All of the 6,700 vaccines for that were available for this week has been filled up. All those appointment slots have been filled up, but you can also click on the following link, which I will post for DC, to see registration and pre-screening forms that can be filled out so that to stay updated on when you can get a vaccine. So the site, the DC site, I'd like to point out, does specify that if you work for specific institutions, you should reach out to those specific locations to coordinate your vaccinations. So you will find that on the website, and you can do so with those particular places. Now, Maryland right now is in phase 1A. And they will plan on moving to, so phase 1A is covering all licensed, registered, and certified healthcare providers, frontline hospital staff, nursing home residents and staff, law enforcement, and frontline judiciary staff, along with correctional healthcare staff. So they will be moving into phase 1B on Monday, January 18th. And their Department of Health website also has the eligibility criteria for 1B and registration information as well. And I will post that. I will just put that link in the chat box as well. One interesting thing I'd like to point out before we talk about the rescue and recovery plan is the New York Times had an article that showed the distribution or actually how many vaccines have been distributed per state. And it's a very interactive map. And I will post that too in the chat box once I'm finished here so that we can, so you can access that as it continues to change. Are there any questions so far?
I think in Maryland, aren't they going to start 1C the following week after next week for individuals 65 and older?
It's 75 and older in Maryland, and the way it's going to be starting next week is you should go to this. Let me put this in the chart. And basically, what they're doing is there's an X amount of pre-specified locations. They're moving into the phase 1B on Monday, so next Monday. And here's the actual link. I had one of my patients call them yesterday, and so she's closest to Suburban Hospital, and they're not taking the sign-ons yet. They haven't started the actual distribution. So they're saying call back on Monday, basically. So anybody over 75, it doesn't matter what pre-existing conditions in Maryland, you should be starting calling on Monday. My suggestion is plan for the whole day to call, because those of my patients in DC who have already gotten the vaccine, they spend on average 4 to 8 hours on the phone. Just put the phone on a hold and just wait. You'll get through eventually.
I listened to Governor Hogan last night, and he said the following week, I thought he said they were going to open 1C for 65 and older after that initial week.
No.
Okay.
Look, go on that website. Every step.
Yes, they've changed it now to 65 and older starting this Monday.
Oh, it's now back to 65? It was 75 before.
65 now, as of today.
Oh, good.
Well, it's 65, I think, for the following week, unless they change that back. They're going to start for the 75 and older next week, and then I think the following week is when they're going to start the 65 and older. I could be wrong, but I thought that's what Governor Hogan said.
No, but he changed his mind this morning, and it's now.
He did?
Yes.
Oh, really? Starting Monday for 65 and older?
Yes.
It's not really. It's interesting that a lot of states picked 75. DC picked 65. Why they picked 75 is totally makes no sense to me, because it's not based on any specific data, right? They're just it's an arbitrary cutoff that was designed for a reason, which they were saying that above 75 the curve of death is dramatically higher, but the problem is severity of illness dramatically increase after 65. So I'm not surprised that they're going to be changing it down to 65.
So I guess it's to register on that same link that you're putting.
I wouldn't, honestly, you register, but I wouldn't wait for that. Nothing's going to happen if you're going to wait for if you really want to push quickly, call them, sit on the phone and get through.
Okay.
When my patients in DC called, they were 128th person in line. So
Okay.
they had to wait for 128 people to go through the phone call before their turn came on. But they waited and they got through and they got vaccinated already.
Okay, thank you.
Yeah, so I'm just looking up online, and it does say that the state will open up the eligibility 1 week later on January 25th to phase 1C, which are residents 65 to 74. Okay. All right.
Maybe this is part of what you'll talk about in Biden's plan, but I'd love to hear what states are like, if there's going to be more capacity just for answering the phones. It seems crazy that this is the same experience we're having in Virginia too, that everybody has to have the time to be on hold all day before they can even schedule, even if they're eligible.
Nothing can be done about this. I'll tell you that ahead of time. Is this going to get better? Who knows?
I'm going to be brutally honest with you as somebody who's had to cover government when I was a reporter. As soon as they get that federal money, then you'll see things improve. Right now, they don't have that money. That's why it's a mess.
Yeah, it's a mess because they don't have a wind power. That they only have an X number of lines. Yeah. And the problem, if you just submit the electronic, you get in some kind of a standardized queue box that just created electronically. You have no control over it. You could be getting lucky, but the only way to actually expedite is to keep calling.
I have registered on email. I don't know if it's registration, but to get information, is that sufficient, or do I still have to?
Grossly insufficient. Nobody's going to email you anything until your line comes up, and we have no clue when it's going to be. So don't rely on electronic registration. That's what I'm trying to tell you.
So do we call the Maryland Health or the county?
You call the main number on the website that Dr. Aboulmouna gave you about.
Oh, she didn't give us a number.
Yeah, there is. It's a coronavirus@maryland.gov. There's tons of different phone numbers. The phone numbers depend on where you are.
So you'll put in your location, and then it'll direct you to a more specific page. But I'll go ahead and repost all of the links for each state. Once I finish here, I'll put it in the chat box.
Okay, thank you.
Thank
Nancy,
you.
Maryland did something a little bit smarter. They didn't give one central. There is a centralized number, but I think that's a waste of time. But they give the numbers for locations. So you pick a zip code you're close to, enter the zip code. It'll give you choices. And then on Monday, there's no point calling now, but on Monday, you're going to start calling these places and see where you get through. And then they'll schedule you. So once you're scheduled, that's it. Golden ticket.
Okay, and Nancy, Dr. Nancy's links, I'm going to put that in the email I sent out to all the registrants after the event.
Wonderful. Thanks, Janet. And then also, I was trying to put the PDF document for President-elect Biden's rescue and recovery plan in the chat box, but for some reason I wasn't able to get it in there. So I'll send that to you after the meeting as well to be distributed.
Great. And everyone, there seems to be some confusion over the handouts and presentations or other materials that show up in each meeting. I put them in a share folder. You can open up any of the share folders that you want. It'll have all any handouts that we received during this event. So that will also, the link to the share folder will also be in the email.
I have a comment about using the telephone to get through to DC. I tried both on Monday, and I was I was 128 in line. And that was about after 2 hours when that was answered, and I wasn't having much success with the website. And there were no longer any appointments left, and that was at noon.
Yeah, that's my point. So you just have to be persistent, call back, and then it's a mess, but there's no choice but to trying. Let me just share something real quick with you guys, because this keeps being answered. So here, I just put my zip code in, and this is what came up for Maryland. So you simply pick a place. You see a lot of them just give you a general phone number on the website, and then some of them will give you a specialized number like this one. So, you know, you just go in there and then you do that on your own, and then you select. So this is their main page where it says access. That's where you put the zip code in right here. And then for phases, you know, this is, oh yeah, no, so they're just moving to 1C. Nothing changed. So 1B is still 75. So nothing changed. The next Monday, they start 1B. 1C is not starting until later. So
The following Monday, on the 25th.
Correct.
Yeah.
18th is next Monday, and that they're starting 75 plus. So unless this website is wrong, the 65 starts after that. You see this? 1C. So plan accordingly.
What time do you suggest we start calling?
It's probably 7 a.m. on Monday, 6 a.m. whenever you get up.
Okay.
That's all I can. That's
Thank
what
you.
Suzanne was trying to tell you. She called at noon. It was too late.
No, I called it. They weren't supposed to open until noon, but I heard at 10 that they were open. So I started a little bit before 10 on and held on the phone, and that didn't pick up till 12.
Oh boy.
Yeah.
Yeah.
So that's
So some people got luckier than you,
yeah.
I guess. Maybe they
Yeah.
called 30 seconds before. It's a mess.
it was a mess.
Yeah.
And by the way, another thing I did learn after that, if you're using portable phones, and you're going to have to keep an eye on the battery during this time. Right. You know, because all you need is to get finally answered and then have the phone go dead. So have another phone ready.
All right. Nancy, do you have a lot more stuff, or?
I don't have a lot more. I'm just going to hit on some of the key points from the rescue and recovery plan so we can get on to our fun part of this program. So, all right. So basically, President-elect Biden has laid out the first steps in a very aggressive plan. It's a $1.9 trillion plan. 2 steps are involved in this plan. It will involve rescue and recovery. And to speak to what we were talking about earlier, a lot of funding is going to go into increasing our public health force as well. So hopefully scheduling or our call lines will have more people on the other end that can answer phone calls and schedule these vaccines quicker. So the rescue plan has 3 main points. First, it's going to focus on mounting a national vaccination program for COVID-19 and safely reopen schools. That is going to be a main focus. It's also going to deliver immediate relief to working families bearing the brunt of this crisis by sending a $1,400 per person check to households across America, and also providing direct housing and nutrition assistance. And the third point in the recovery or the rescue part of the plan is to support communities that are struggling in the wake of COVID-19 by providing support to the hardest hit small businesses, especially businesses owned by entrepreneurs of color, and protecting the jobs for first responders and transit workers and other essential workers as well. It's a 19-page plan, which again, I'm going to send to Janet so she can distribute to you. I can't go over all of the rescue parts of the plan, but I will point out some of the key points. Sorry, I already went over the rescue component. So I'm going to leave it at that. It's quite a long document, but again, there's a lot of funding that's going to be provided to increase public health support to get vaccinations scheduled sooner, quicker. Many of you may have already heard that there's a plan in the first 100 days of the president's time in office to have 100 million vaccinations distributed. So that's all I have, and I will send all this information and all the links to Janet so she can distribute that to you. Stay safe and well, everyone.
Okay, that was a lot of information, but as usual, it's very important and necessary information. But now it's time for the fun part. So I'm going to turn things over to Sage Raindancer, and welcome, Sage.
Thank you, Jeanette. And thank you everyone for being present and joining us for today's forest bathing walk. And I'm just double checking, can you folks hear me well? Can I just get like a thumbs up? Okay, outstanding. Thank you very much. And for those who have not heard about forest bathing, let me just give a little bit of an explanation of what it is. And I guess the most simple thing to say is this: if you've ever been a walk into the forest, you've been on a forest bathing walk. And honestly, you don't have to do this necessarily in the forest. Any nature scape will be sufficient enough. Even what green spaces we have here in DC. And mostly for forest bathing, one of the things that we want to do is pretty much slow ourselves down. And what we typically do on our walk, well, I shouldn't even say it's a walk, it's more of a saunter, more of a stroll. So it's a slower paced moment in time as we walk through. And currently, I am at the National Arboretum here in Northeast DC, and I'm in the Asian collection. And so I do want to acknowledge the National Arboretum and the Friends of the National Arboretum for having me here and being here in their space. And also would like to give an acknowledgement and a bit of gratitude for the original stewards of this land, which would be the Anacostia tribe, as well as the Piscataway tribe. And as you know, the Anacostia is also the name of the river that is saddled up against Maryland and DC. And actually here from the National Arboretum, you can access the Anacostia, and I've seen folks access the Arboretum through with kayaks onto this little dock they have nestled here on the river. So it's a nice little spot. And so thank you to Jeanette and GW for also having me here. So one of the things that we'll be doing, well, several things, is what we call invitations. And these invitations are just that. They're an invitation to connect back to nature, perhaps in a different way than we have before. And so I'll be guiding you through these different invitations. And I know mostly everyone's out, or rather inside. And if you're outside, just be mindful of where you are. And if you're inside, just go ahead and get comfortable. And you can either observe nature through your window, or you could just observe nature on your screen and what is before me. So one of the things that we start off with when we start forest bathing is what we call pleasure of presence. And that is a way to connect to our current space and time of being here and right now. So if you've ever gone to a yoga class or even a martial arts class, I'm sure you've done a moment of breathing. And so we'll go ahead and start off with that. And so either bring your eyes to a soft gaze, or go ahead and close your eyes. And thank you for the nice yawn. And if we could also go ahead and mute our phones, I'd greatly appreciate that. And you may hear some background noise. As I said, I am at the Arboretum, so there will be nature sounds as well as man-made sounds. So just a forewarning. And if you're familiar with what's going on here in DC, there may be a lot of helicopters overhead at some point. So just a fair warning. So if we can go ahead, bring our eyes to a soft focus or a soft gaze, or go ahead and close them. Take a nice gentle deep breath. Gently exhale. And once more, nice gentle deep breath. Gently exhale. Now let's imagine ourselves getting comfortable in this spot, whether we're sitting or standing. Let's just visualize our feet and our legs just slowly sinking into the earth. And as it sinks deeper and deeper into the ground, you can feel the earth as it comes up towards your waist. From your toes to your legs, they extend downward like the roots of a tree. And I wonder what your roots are sensing. I wonder how your roots smell or taste the earth. And again, nice, gentle, deep breath. And now let's bring our focus to our pelvis, our hips. As they connect to those roots, they're partially beneath the ground and partially above. I wonder how that feels to you, the tree. The midpoint in two different spaces. The coolness of the earth below, perhaps the warmth of the sun above. And again, nice, gentle, deep breath. And as we inhale, we'll notice our torso, our trunk expanding. We'll notice our trunk, perhaps reaching up further towards the sky. And I wonder, are you the type of tree that sways gently in the breeze? Or do you stand tall and strong, rooted to the ground? And again, nice, gentle, deep breath. Bringing now our awareness to our branches. The branches that reach out from our trunks. The branches that reach up to the sun. Or do they reach to the ground like a weeping willow? And again, nice, gentle, deep breath. Now let's bring our focus to the crown of the tree that we are. I wonder how high our crown can reach up into the sky. I wonder what the wind feels like as it caresses the branches and the crown. And again, nice, gentle, deep breath. And let's take a moment to be this tree. settled here, grounded. And if we can come back with those chimes, back to this moment. So typically what we'll do on a forest bathing walk is share. And how we will share over Zoom is what I would like to call a chatterfall. So if you would like to share, what I would suggest you do is go ahead and type it in, but do not send it just yet, because I'll have you send it when I count down. I'll count down 3, 2, 1, send, and then we can all send it at once. But please hold. So what you will reply or what you will be sharing is in one sentence with one word. What are you noticing? What are you noticing? And I'll give you a moment to just go ahead and key that in. And just so you're aware, also, sharing can be done silently as well. So I'll give you a few more moments to come up with that single sentence and that single word before we start our chatterfall. And again, wait for me, please, to start our lovely little chatterfall. And I'll start the countdown in 5, 4, and yes, when I say send, we'll hit the button. 5, 4, 3, 2, 1, and send. Feathery branches, fresh air, fresh air, fresh air. Oak, feel expansive. Oh, awesome, everybody. Thank you for sharing. It was flying right through there, that chatterfall. So our next invitation, and this is one, what I call, or what we call, what's in motion. So what I will do is flip my screen around, and I'll sit here for a few moments, but I will be getting up and moving to a different location, and you can still observe the screen if you like. Again, I'll be moving at a slow pace. And in fact, I'll take my headphones off so you can hear the space that I do, so it's not covered up by my little scarf here. But if the movement gets too, I know it can be a little choppy for some folks. So if you'd like to, if you're at home, you're more than welcome also to look outside of your window and just to observe what's in motion. So bear with me as I turn this screen around. And there we go. And as I said, we'll be here for a moment, and then I'll slowly start to move. We'll be moving, or rather, I'll be moving in silence since I'm by myself here. We can just keep things that way. And I'm going to unplug my headphones now. welcome back, everybody. Welcome back, everybody. So we'll do our chatterfall again as we share. And our prompt now is, what are you noticing? What did you observe? So we could just take a moment again to have that one sentence with one word. And again, we'll wait that countdown. Give you a moment. And let's see, 5, 4, 3, 2, 1, and send. Let's see what we have. Nature, everything, birds, became so real. Mother Nature, appreciation, appreciation, stillness, green. It's so hard to read, so peaceful, quiet, peaceful, quiet. Nice. Thank you, everyone, for sharing. So those are just 2 invitations for our forest bathing walk, and we'll typically finish off with our final invitation, and that is our tea ceremony. And typically for a tea ceremony, when we go on hikes where we are able to harvest some herbs or plants, we may use those for our tea ceremony. However, because I am here at the National Arboretum, which is essentially truly a science research center, it's not someplace I want to be picking up any of their plants and stuff here on the ground. So what I typically end up doing is making my own tea. And the tea that I have is a ginger tea. Just reminds me of my mom. She's somebody who makes tea from ginger, and I remember that growing up. And she would harvest not lavender. What is it? I guess it's not lavender. Oh, mint. That's what I was thinking of. Mint. She would harvest that from the garden, and we would have that for tea. That was her favorite thing. So just kind of in memory of my mom. Is having ginger tea. I should not say it like that. My mother has not passed away when I say in memory of my mother. Her birthday was earlier this month, so she's still alive and well. She's actually, on her birthday, she won her 4th place championship in women's doubles tennis at 78 years old, so she's alive and well. It's just for her birthday memory. I have the ginger tea. So this tea that I have brought, I don't know if, here we go. Here's the tea, and I have it in 2 cups. And we set this down. I also have a 3rd cup here. 1 cup is for myself. Let me get my cups here so we all can see them. So as I said, I have 3 cups here filled with this ginger tea. 1 is for myself. 1 is for each of you who are here, who have joined us for today. So if you actually have a glass of water or a bottle, by all means, go ahead and grab that. That can be your tea. But this is your proxy tea here with me. And lastly is this 3rd cup of tea. And this 3rd cup of tea is for our host. Our host is not the National Arboretum, nor is it friends of the National Arboretum. The host is actually our grounds, this grounds that we are on, the ground that actually supports me and supports you here. The host is the trees that give us shade. The host is the land that provides us food. So with much respect, I would like to say thank you for our host. And if you would like to share anything that would bring this forest bathing walk, that make it feel like a good closure for you, by all means, you can say that out loud. If you want to put it into the chatterfall, we can do that as well. Or you can just look at this cup and just focus that intention into this cup. I'll take a moment to do that. And if you want to do the chatterfall, that's okay as well. I'll give you the countdown of 5, 4, 3, 2, and send. Okay. Thanking all the mothers, gratitude to the land, love, sunlight, air. And so I just want to share this, and I'm going to pour this back into the ground. And with your proxy cup here, oops, this is for you all, this is for me, maybe cheers. And that, my friends, brings us to our conclusion of today's forest bathing walk here at the National Arboretum. So thank you, everyone, for joining us. And I think we may have a few minutes if, I don't know if anyone has any questions. I think Jeanette mentioned we may be able to do that if anyone had anything to say or questions about the forest bathing itself. Thank you. Thank you all for joining.
Thank you, Sage. If anybody has any questions, you can put it in the chat, or you can just unmute yourself and ask.
Thank you very much, Sage. Are there any places you recommend in addition to the Arboretum for walking?
Honestly, any green space that's near your home. But I mean, because I'm not sure where you are, but most folks, I mean, like I said earlier, if you just have gone walking anywhere, like even if it's in your neighborhood, you can still do forest bathing there. The key thing, I think, is being able to slow ourselves down to observe what's here in nature, and to see things, interestingly enough, at a macro and a micro lens. I do think that, yes, slowing things down, strolling as opposed to rushing through things would definitely be helpful. Because when we're doing forest bathing, as I've said, it's more of a saunter, more of a stroll. We're not what they call peak beggars that are trying to race to the top of a mountain. We're not ultra marathoners. No, we just want to take the time to just enjoy that journey. So anywhere I honestly would say is a good place to go. But if you want more green space, here in the local area, I mean, any of the state parks, everything from Rock Creek Park to the Shenandoah to the C&O Canal. I live in Montgomery County, and I've done this with my son along some of the side trails and bike trails, like the Matthew Henson, the Bethesda Trolley Trail. Any of those would work as well. And I mean, I've done this also along the Chesapeake Bay at Sandy Point Beach, so that was nice as well. So. And there are guides throughout the world that do this. Some do it on beaches, some do it up in the mountains. So again, and I know there are some in the Southwest that do it as well in the desert. So hopefully that answers. What do you do to avoid Lyme disease when in the woods? Layer up and try to get some sort of, whether it's what is it, chemical like DEET, or if you want to go with something a little bit more natural, then I know there are things on the market for that. But yes, and there's actually, unfortunately, the name is escaping me right now, but there is an app to track where Lyme disease sightings, but where notifications of Lyme disease has been found and where where the ticks are. And so, yes, that's another way of dealing with that.
Another thing to remember is that ticks don't go dormant when it gets cold. I learned that a couple of years ago.
Oh, and hopefully Cecilia just answered to your question about the ticks not going dormant. I don't know if I missed any questions on there. I think I'm okay. Oh, we don't get cold enough long enough to kill them.
Oh, but a couple of us are asking if you're still leading in-person walks these days.
Oh, actually, yes, I am. I'm doing that here at the Arboretum, and you could actually go to fona.org and get onto their calendar of events. And it's myself and 2 other local guides who do that. So that is one place. And I also work with a group called natureworks.org, but we work with specific demographics. So we are actually working with folks dealing with addiction and recovery, as well as hopefully this spring we'll be able to work with the veterans, which the founder, Phil Hosmer, and I did a pilot program back in October and November, a 6-week program with the veterans up at Perry Point up in Maryland. And They enjoyed it. I enjoyed it. It was a pleasure for myself for the mere fact that I'm a veteran myself. So me serving those who have served before, to me, it was a lovely reciprocal feeling. But yes, the other public ones I'll be doing is with, A Greener Mind. You can look at agreenermind.com. Another guide, and I will be doing some full moon walks with, and that is located in Bowie, Maryland. Or Bowie, Maryland. Bowie, Maryland.
Bowie.
So, Bowie, yes.
Although it would be cool if it was Bowie.
Right. And
who doesn't love Bowie?
What's that?
Who doesn't love Bowie?
Right.
Okay, everyone, I am going to gather together all this wonderful information in the chat and send it to you in an email, along with the document that Dr. Nancy spoke about. So we'll see you hopefully next week. There'll be a link in the email with the registration for next week. But meanwhile, have a beautiful weekend. Thanks for coming.
Thank you. Bye-bye, everybody. Enjoy your weekend.